bullseye. Okay, check it out. Listen, look at that. Pretty good, right? So what did we do? The thing that people don't like, they do not like it when the face and the neck blend together. I have a patient that calls it the face cankle. And I'm not saying she has the face cankle. It's not my terminology, but I have a patient that says, oh, I got this like face cankle. My face and my neck kind of blend together. And another patient that said their face looks like a thumb. I mean, these are classic things that people say. So what we want to do is we want to separate the face from the neck. You want the jawline to kind of snap in. This is the triangle Coughlin back there. Really get that to push in. You want to define the ramus, the body, and the SCM. This is the peaks and valleys. People like my description of that because you peak it out there in the upper third, you push it here in that middle third, you peak out the jawline, lengthen the jawline a little bit, you push it under in the triangle of Coughlin. That's the SCM, sternocleidomastoid muscle, the ramus of the mandible, the body of the mandible. Then there's the parotid gland, then there's the orbicularis, the risorius, all these muscles, the parotid duct, the facial artery, the facial nerve. We're defining all of these anatomical structures, and I'm tightening and removing or repositioning the stuff that we can. So, for instance, the buccinator muscle, the closest thing, it goes buccinator muscle, then the buccinator mucosa, then the tongue, essentially, from the inside of the mouth. So that's a layer that I learned you can tighten. You can add that to people to create a little bit of this valley in the buccal space. It's beautiful. For the people that don't want buccal fat to be messed with, I can do that and actually picks up the pre-jaw a little bit. Picks up the pre-jaw. Listen to that. I mean, that's beautiful, right? That prevents aging. You can take the fat out. Many people I recommend taking the fat out or manipulating the fat one way because I think it helps to prevent that bulldog look. But that's that. Again, and then here, if you get the front of you take her chin, you kind of pull it forward. It gives the illusion of that mandible being a little longer. I kind of follow the direction of the body of the mandible, and we advance it in an anterior-inferior direction, kind of pull it like that. But when you actually build the bone stronger, it pulls the structures forward. You know, I say the people that don't see me have this. They're all stretched out. They got high cheekbones and big chins. So their buccal space, their mid-cheek, it's all taut and tight. People that see me often have a smaller mandible, so everything's kind of smushed together here, right in that buccal space. It's like, and you can do buccal fat in those people because they may not even have a huge fat pad, but the space that it's occupying is small, so therefore we can manipulate it to help create that contour look. It's a really important point. A lot of surgeons don't even get that, so you're welcome. Now, the other question I get that's very common is how much does it cost? What do I have to pay? Every patient is a little different. I have a whole wall of faces in my office of the people I did the last couple weeks. I got every race, man, woman, age, sexual orientation. I mean, all of that kind of comes into play on your baseline anatomy as well as your final outcome and goal. So because of that, I have to do something a little different in each person. Like in her, I did an extended neck and jawline sculpting that's lipoid all the way back to this posterior hairline. I've even gone circumferential with a few people. I did a small chin implant to advance her chin along the angle of the mandible. And then we did buccal fat, Chicago style, mucosa, and muscle tightening. So all of those together are what got her what she wants. You know, sometimes I do a little fat transfer to this upper third, the face BBL. Because you make that peak a little sharper, you make that valley a little deeper, and that's what leads to those shadows and curves. Peaks and valleys for shadows and curves. So every anatomy needs something a little different. You know, I talk about the face in 3 dimensions. It really is probably 3-dimensionally the most important part of our body, I would say. You know, it's dynamic, it's mimetic, there's structure, there's fat, there's contours. All of the body has it, but you know, that's the one that we see because of the swivel of the neck in all the dimensions most frequently. So because of that, it's the volume redistribution that we are able to utilize to contour, sharpen, and more or less snatch people. So again, if you want to see both together, there you go. You know, that demarcation, kind of creating those lines. And she's only a couple months post-op, so this is just going to get sharper, you know. And it can be really odd that I'll tell people that I will add volume when they feel like there's too much volume in their face already. They feel too round, they feel like there's fat, and I recommend adding some volume. They're like, no, dude, I want you to take stuff out, not put stuff in there, you idiot. But I have to explain how this structure component is really common in many people. That's how we did it in her. As somebody else might require something a little different. Similar goals in many people, but the outcomes and what it takes to get you there is different. Like, subscribe, comment down below. Stay tuned for more plastic surgery, commentary, videos.